Blood supply of brain. The brain is supplied by two main arteries, a pair of internal carotid artery, a pair of vertebral arteries. The internal carotid artery enters the skull by passing through the carotid canal, and the vertebral arteries enter the skull by passing through the foramen magnum. The branches arising from the internal carotid arteries and the vertebral arteries joins to form a circle, arterial circle known as circle of Willis or circulus arteriosus. The branches are: number 1, anterior cerebral artery. It's a smaller terminal branch of internal carotid artery. Number 2, middle cerebral artery. It is the larger terminal branch of internal carotid artery. Number 3, posterior cerebral artery. It is a branch of basilar artery. The basilar artery is in turn formed by the union of the right and left vertebral arteries. Number 4, anterior communicating artery, which connects the two anterior cerebral arteries. Number 5, posterior communicating artery. It connects the internal carotid artery with the posterior cerebral arteries. So these are the cerebral arteries which supplies the brain. The cerebral arteries divides into or gives rise to three types of branches. Number 1, cortical branches. Number 2, central branches. Number 3, choroidal branches. Blood supply of different surfaces of cerebral hemispheres. The greater part of the superolateral surface is supplied by middle cerebral artery. The greater surface of medial surface is supplied by anterior cerebral artery and posterior cerebral artery. A small part is supplied by middle cerebral artery. The greater part of the inferior surface of the cerebrum is supplied by middle cerebral artery and posterior cerebral artery. A little part by the anterior cerebral artery. The cerebellum is supplied by three branches, that is three pairs of arteries: superior cerebellar arteries, anterior inferior cerebellar artery, and posterior inferior cerebellar arteries. So a pair of superior cerebellar arteries, anterior inferior cerebellar arteries, posterior inferior cerebellar arteries. The superior cerebellar artery and the anterior inferior cerebellar arteries are the branches from basilar artery, that is they arise from the basilar artery, whereas the posterior inferior cerebellar artery arises from the vertebral artery, that is it's a branch of vertebral artery. These three branches supplies the cerebellum. Clinical anatomy. Cerebral thrombosis most commonly affects the middle cerebral artery or the main branches arising from the middle cerebral artery, since it is a direct continuation of internal carotid artery. Thank you.